Well, at least in endocrinology, as the way I see it, there's three epidemics: diabetes, obesity, and osteoporosis. And look at what we're talking about. We're talking about exactly those three epidemics. This isn't a coincidence that with aging, with the lifestyle we lead, that osteoporosis, diabetes, obesity all sort of hit at the same time. It's not a coincidence. There is a link between those. It's a systemic link, but what the exact pathways are, we still need to figure that out. But once we figure that out, which may or may not happen, I don't know. As I said, the clinical situation is a mess in many ways. But maybe we figure it out, which of course then could lead on to clinical intervention, could be used in preventing. When we published our work on glucocorticoid-induced metabolic changes in the JCI in 2012, I believe it was, Ron Kahn wrote an editorial and saying, oh, now we can use osteocalcin to prevent glucocorticoid-induced diabetes. And while that is a valid thought, we're very far away from the clinical intervention at that sort of level. As usual, people, when they see these experimental data in mice, they start looking in clinical settings, like in population-based studies or in clinical studies, etc., etc. But from what I've seen so far, there's no real firm evidence that any of what we've seen in mice in terms of the glucocorticoid setting would translate to humans. I haven't really seen any good data. It's very different for the situation when we talk about physiological or the physiological role, for example, of osteocalcin in fuel metabolism. There we've seen quite a bit of clinical data that seems to suggest that indeed osteocalcin could act as a bone-derived hormone that is involved in human metabolism. But again, even there, the data, I would say, is relatively messy.